It's time to think differently about healthcare, but how do we keep up? The days of yesterday's medicine are long gone, and we're left trying to figure out where to go from here. With all the talk about politics and technology, it can be easy to forget that healthcare is still all about humans, and many of those humans have unbelievable stories to tell. Here, we leave the policy debates to the other guys and focus instead on the people and ideas that are changing the way we address our health. It's time to navigate the new landscape of healthcare together and hear some amazing stories along the way. Ready for a breath of fresh air? It's time for your Paradigm Shift.
Welcome to the Paradigm Shift of Healthcare, and thank you for listening. I'm Michael Roberts with co-hosts Jared Johnson and Scott Zeitzer. On today's episode, we're talking to Dr. Justin Smith, a pediatrician and the medical advisor for digital health for Cook Children's in Fort Worth, Texas. You know him as the Doc Smitty on Twitter and Facebook, where he has active communities and engages regularly with patients and clinicians. Hi, Dr. Smith, and welcome to the show.
Yeah, thanks for having me. I'm excited to be here.
Hey, Dr. Smith, this is Jared. I'm just glad and thrilled to really reconnect with you. It's been a few years. You and I have known each other for a little while. I've even had you as a podcast guest previously. And I'm excited to really circle back with you to see how things have been going. There were a lot of things going on early on years ago with the vision that you'd had for digital health. And really, as we bring that into focus for this program, for Paradigm Shift, we've been talking about shifting mindsets, how people are literally changing the way they think about healthcare. And there's a lot of different ways that you have addressed that yourself. But I'll just reiterate to our listeners just how, there's no other word for it. I just think it's cool. The work you're doing, the efforts you're putting into really changing the face of care and using technology to do it and recognizing that there are ways to successfully engage with patients online. So those are some of the things that we're going to jump into today with you. But one of those very first things that I've always associated you with is being able to successfully implement and use digital health with your care model itself. And maybe that's a good place to start, because as we talk about, like I said, how people really are thinking about healthcare differently, digital and technology are really things that can't, in the past, they've been divisive almost in the clinical community and with patients as we try to figure out what its proper role is. So I'm curious, just first and foremost, and maybe this is just indicative of your philosophy itself, I'm curious what role you think the digital health plays in improving patient care.
Yeah, I think, as a pediatrician, it's one of those things where I think I want to engage really at this point now, I'm looking at Gen Z parents, I'm really past it. When I first started, it was really trying to figure out how to engage with millennial parents, but now it's really that next generation. And I don't think that I really have the luxury not to figure out how to use digital health, because that's critical to what my new parents and what's important to them. They've grown up digital natives. It's just a part of their lives. So I think it became just something that I saw as a need, and it's only growing more as a need. I think the role it plays in digital health, I think we talked a few years ago, but, it's interesting that, it's over time, I've gotten a little bit more structured in the way I think about it. And so I've really kind of figured that in my practice, my digital health engagement with my patients really fits in 3 different stages. And so I look at it from what I call a pre-encounter stage, an encounter stage, and a post-encounter stage. And so I'm trying to engage in different ways with parents along that spectrum in a way that I find keeps them engaged with me, even when they're not here in the office, because that encounter stage is so brief relative to the rest of their child's health journey, whether they be healthy and are just needing guidance along the way, or whether they're sick and need more support.
Absolutely. So this is Michael. My daughter has a condition where we're back seeing our pediatrician on a very regular basis. And so one of the things that we have to deal with quite a bit is that in between, is that, hey, we've already seen the doctor and we've had that initial conversation, but what are we going to do when this next question comes up? How are we going to handle it? How are we going to talk to the right nurse, get in touch with the right people in order to get our questions answered in between? So I love that you're thinking of it that way.
Yeah, and I think that's so many different ways. Like you can, if I as a pediatrician lay out the expectation for, hey, here's what's going on, here's what I expect to get better. But if it doesn't, I want you to message me, or, hey, we're going to treat this rash, but if you don't think it's improving, just shoot me some pictures in a couple weeks and we'll make an adjustment. Even if the family does get better or it does follow the expected course, just having that peace of mind that, oh, it's just as easy as sending him a message if things don't get better, it's a game changer for that parent. They're not having to go home worried about what that next engagement is going to look like when or if things don't get better.
Doc, just curious, you said you broke it down into 3 phases: pre-meeting, during the meeting, and then, of course, post-meeting. So from a pre-meeting, what kind of expectations are you trying to set? What are you trying to get to the patient and family, and from the patient and family?
And so for that, there's a couple of different things I do. My biggest thing from a pre-encounter perspective is engagement via digital health, and engagement via social media, really more specifically. And so I am super active on Facebook and Instagram are primarily where my patients follow me. And I'm not directly engaged with them there so much, but for instance, on my Instagram account, I have summary videos for each checkup. So I'm up to now, I've done the 9-month checkup, and I have families who have followed along with those. And so before they come in for their 2-month checkup, they'll go and watch the 2-month checkup video on my Instagram highlights. And that gives them the high level of what I would normally cover at 2 months. That way, if they have those basic questions, they can get those answered. They know the questions I'm going to be asking them, so they're really efficient in responding to my questions when they're in the office. And then we can hit that next, when they do come into the encounter world, we can hit that next step and that next level of questioning. So I'm not having to ask them the basics of the basic questions that I have to ask everybody else who hasn't seen those videos. So social media is primarily what I think of from a pre-encounter perspective. But I also think you have to think about it too, in terms of a family, maybe from a more illness perspective. You have to be aware that something like 65% of people, when they're dealing with a medical problem, have already done some searching online to try to figure out what might be going on. And so it might not be me using it from a pre-encounter perspective, but I know my families are. And so populating the internet with high quality source material that they can come across and find, it's not unusual for a family to come in after having dealt with something for them to say, gosh, our kid had a febrile seizure, but we found your article about febrile seizures and we had already read it before they came in. And that's like the ultimate for me, because that's why I got into this space, was try to provide good information out there for parents to come across.
You're setting good expectations and providing good, well-vetted information for people before they come in. They then can get a running head start when they're meeting with you. And then it seems like from a post-encounter, you're now able to have a conversation with them and maybe settle what could be really bothersome things with just a quick comment back to them. Is that the overarching strategy, so to speak?
That's right. Most of my post-encounter stuff, though, is going to be done via our patient portal. We have a fairly clean patient portal that allows the family to send me a direct message. It's got push notification both ways. So that actually is nice, because then it filters right into the patient's chart.
That's interesting, because as I was thinking this through, you've got it connected to your EHR, electronic health record system. And then is that quote unquote billable, that kind of consultation, or is that just part of the bundle, so to speak? And I'm sorry to be so economic about it, but sure, I'm curious.
There are workflows where you can build in a payment model. You could submit them to insurance. For the most part, they're going to deny those claims. And so from my perspective, the sort of brand bump that I get, in a sense, from providing that level of service is worth way more to me than any $5 charge I could get for responding to a message. Because I guarantee you that family tells one other family about it, and it becomes well worth my time to respond to those messages.
Yeah, that's really interesting. And I'm fascinated by this, and I know Michael had some questions about your clinic setup.
Yeah, I can attest from the other side, though, of being that parent on the receiving end of that.
Yeah, sure.
Because not only my wife is the one that ends up dealing with a lot of the following up with the doctor and asking the questions and all that. She's far smarter than I am in all that area. But to have her feel relieved, to have, to know that my daughter's okay, but then also to see how much relief it brings to my wife, certainly has helped us sing the praises of our pediatric team for sure. I'd love to hear more about how you designed your clinic and what was different about it, and how you feel that it helps improve patient care.
Yeah, so I was fortunate that I came to my health system, Cook Children's, already having practiced pediatrics for like 4 years. And so I had some ideas about kind of how I wanted things to work and how I, as building a practice, I wanted things to be different, but had a good functioning knowledge of running a practice and taking care of patients. So I had a little more mental bandwidth to think through how things might be different. So that really set me up well to do what we did. And basically the system came to me and said, hey, you have clearly some ideas about engaging with patients that are a little bit different, a little bit more forward thinking than many pediatricians, many doctors do. And so we'd like for you to start your own clinic. And at that point, the location that we picked, we didn't have a clinic in the area. So we were basically starting from scratch and had a shell. So that afforded me some time to really lean into what parents in this area wanted. And so I was able to kind of solicit some general feedback via my social media channels. And ironically, even though I'd never practiced in this area specifically, I had a ton of followers up here. It just happened to be so. And so I realized pretty quickly who was from around here who was responding to my questions about how would you like for things to be different. And then I took some of those people who were responding quite a bit, had some good ideas, and really talked to them a lot more, including some email follow-up and then even some personal meetings where we met with them and interviewed them and got some ideas from them, and really just kind of leveraged their expertise as parents and grandparents. And we have a lot of different types of caregivers who might be the person bringing the kiddo into the doctor, and built really everything, or not everything, but we built a clinic that was centered around their ideas, which really was a refreshing way to do it and led to some subtle changes that have really made a huge difference for our families.
I'd love to hear a little bit more about that. Just for a personal experience, my daughter was involved in one of the local hospitals, picking out the design for the room so that when you go in to get scanned, it's not such an intimidating process. It's a fun design, but I'd love to hear a little bit more about some of the details that you think really made a difference.
Yeah, so a couple of things. One of the things that was really cool, because as I've worked through this and wrote down ideas and started building them, what it really came down to is that it's something I call the 3 E's. And patients really wanted engagement. So they wanted a physician, a pediatrician who, when the patient was when you were in the room with the family, that the pediatrician was engaged with them and not just spending 100% of time documented in the EHR or, distracted the whole time. They wanted somebody who's really engaged. They also wanted engagement in the community. And so it was really important to them that we have a float in the 4th of July parade that just happens to run right in front of our office. And so we knew early on that those are the types of things we need to really be involved in this community. They wanted efficiency, and so that's the 2nd E. And so we really built it, everything that we could, all of our digital health, all of our check-in tools, everything is to put minimal burden on the patient so that by the time they're back in the room, they're ready to go, and we're doing all that as fast as we can. They're not having to fill out the same forms over and over again. They wanted to be able to access information through the portal, so we've turned every portal feature we can on so that they can get as much information as they can through their portal. And the last thing they wanted was empathy. And so they wanted, the whole staff to care. And so we've really worked hard in terms of our recruitment of the right staff who can provide that high level of empathy. It's not uncommon for the patient to hear from every staff member, I'm sorry that they're sick today, or I hope they feel better soon. And we really train our staff that every phone call, even if it's the 10th ear infection we've heard today, may be something that family is really worried about for some reason or another. And so we really work hard to make sure that they're getting that high level of empathy from the first time they call till the last second that they're walking out the door.
It's really great. The use of social media for a lot of, or just good patient education, you're basically providing well-vetted, good patient education, and you're using social media as your platform, whether it's, I presume, Instagram or Facebook, or just content on your website, which is not social media, but it's just good content. Let's talk about that. Something very simple for lots of parents with newborns, the rule out for the ear infection, where the baby is crying and is stuffed and they're new parents, and most of your time is spent looking inside and saying, yep, that's a head cold, and I'm sorry that you won't be sleeping a lot for the next 2 days, and here's some thoughts about that. Do you put that kind of info up on your site so parents can feel a little bit better before and after that same info can be, I guess, correct?
Yeah, so just thinking about that one specific use case. So I have I have a couple of different articles and a couple of different social media posts I've done over time about like, here are the 5 real symptoms of an ear infection, because there's so many old wives' tales out there about it. So that my families, and a lot of them they'll search my Facebook page and find old posts, or they'll search on our newsroom and find posts where we've written them that will actually give them some guidance about whether, do I need to book this appointment, or is this something that I can just watch at home? And so I think we try to help guide them through social media and through content to making the best decision about whether they even need to be seen or not. But then secondarily, like on the back end of that visit, let's say they didn't have an ear infection. Well, whenever a child comes in with a cold, one of the things that I do on the back end on their after visit summary is I have, quick text, and I have basically with just a few keystrokes, I can drop in a whole bunch of information, and I'll even through their after visit summary link out to articles I've written about the condition. So fever is probably the best example because I've written so much about fever. Anytime a child comes in and I diagnose them with fever or a viral syndrome that I'm not necessarily treating an ear infection or strep throat, I'll send them like 7 or 8 different articles they can read about fever after the visit. So if they go home and they're like, okay, well, should I treat this or not? When shall I let it run? Like they're going to have all that information in their inbox that they can review after the visit.
Yeah, and that's a great balance of, especially for Generation Z, of empathy as well as efficiency. To your point, they're used to getting all this content online, and you directing them to that well-vetted information has got to be something you get a lot of positive feedback regarding, I would assume.
Yeah, definitely. They'll come back in a checkup 2 months later and say, after we saw you, his fever went really high, but we read your articles, we did what your article said, and we didn't even call you because he was doing better the next day. And I'm like, yeah, perfect. That's exactly why I do what I do. So that's very validating and very, reassuring that it's actually worth it and that the parents are seeing the value of it.
Yeah, and do you feel like that kind of strategic use of social media that we've been talking about enhances your relationship and solidifies that bond?
Yeah, no doubt. So definitely, I think the parents who came to me because they knew about me from social media or who follow my page, we have a different level of relationship than the parent who didn't or who's not really involved in social media. And that's fine. I mean, I have great relationships with everybody. It's not important to me how you want to sort of engage with us. But I would say that it's clearly different when I post stuff about my family as well, and I'm careful about their privacy and everything. But at the same time, I think it's important for my families to know that I have some of the same struggles that they do. And so there's another level of connection just based on that piece too, that sort of endears you to them in a way that's different than, the doctor that is standoffish or is not warm and is not involved in some of these things that are really a key part of their lives.
It's very interesting from my perspective, having grown, my kids are now in graduate school or beyond. But I remember I was married to a doctor with 2 young children. I'm a biomedical engineer who worked my way through school as an EMT. And I can't tell you how uncomfortable I still felt with both of those kids when they were young with something as simple as an ear infection. And I was empowered with a lot of good information. So this is just great stuff for people who, they could have MBAs for all you care, but it's their child and it's their young child, and they just don't feel like they have everything they need, and being able to just go online and see it one more time. What did he say? Okay, now I feel better. That's got to be great for them.
Yeah, I think it is. And I think that I think a lot of physicians worry about, it's going to take me so much time. But if you really think about it, if I'm going through my little spiel for fever, but I know it's a family that's on the portal and I say, hey, let me just tell you these 2 or 3 things, but let me tell you what's more important is I'm going to send you out a whole bunch of links of information that you can read. Well, they're much less likely to spend 20 minutes asking me more follow-up questions because they know that information is coming to them. So just that reassurance that it's there, whether they look at it or not, just they know that it's there and they can access it if they need it. It ends up being a huge time saver for me because I'm not having to answer 5 million questions about it. I mean, I'm giving the 2 or 3 highlights and then giving them more resources that they can access if they need it.
Yeah, Dr. Smith, I remember, besides this, your approach to this whole patient-centered, patient-designed clinic, just your whole approach to care, the one thing that has stuck out to me over the years that we've known each other that you've shared with me is this thought towards the clinical community about the use of social media. And I remember you kind of coining a phrase to me about how towards other clinicians that if you're not producing good health content out there, how can you complain about the bad information that's out there? And those who are, how can you blame somebody for trying to Google answers for their condition or what's going on? How can you blame them if you're not even attempting to put out good vetted information out there? How has that gone? Has that conversation with the rest of the clinical community changed much, or what are you seeing there? Are there more clinicians who are open to it and are trying to explore how to do that? What's been the change lately?
Yeah, it's definitely changing a lot. I wrote my first blog post like 9 years ago almost, and that was when I was on my own in private practice in West Texas. And then everybody was like, "Oh, you're crazy. Why would you want to do that? People are just going to get on." It was a big thing then. Now as my role has just changed. Now I'm the medical director of digital health for our health system. And we had to do that because so many physicians want to be involved in writing that we had to have somebody with some supervisory role to go back to them and say actually, we can't put this out there. And here's why. It has changed a ton. And I mean, it's happening for 2 reasons. Number one, I think that our more seasoned physicians are seeing the value and seeing that perhaps they might have overestimated the risk. And so then all of a sudden that reassessment of risk versus benefit is changing for them. Number two, we're recruiting and hiring more and more recent graduates who are millennials and maybe some Gen Z physicians. And so for them, it's like, why wouldn't you do this? Everybody should do this. And so it's just a little bit different perception from their viewpoint. And so I think when I first started at Cook, on our newsroom, we had like somewhere in the realm of like 30 physician contributors. We're now approaching 300 that have contributed to our newsroom or to a social media post of some type. That's about half of our clinical staff. It's been pretty interesting to see that dynamic happen, where I was kind of originally thought as the crazy guy. Now I'm kind of seen as the resource for how to do it well and get it done right. And it's just a mind shift change that's happened.
Yeah, I'm thinking you guys might actually start focusing on, from a library perspective, your volume's so high, how you structure pathways to get to information quickly and effectively, and maybe even get some of your more recent contributors to add where there are holes rather than where you've already got a few articles, kind of a thing.
Yeah, definitely. Management of the amount of content is an issue because we do publish like a newsroom. So we're publishing nearly every day. Last time I counted, I was near the 500 article range just myself. And so it definitely creates some issues. And, it's interesting because, I've written about fever. Like I said, I think I have like 10 articles on fever now. But we also want to encourage a new doctor who wants to write about fever to go ahead and write about it because they may have a different perspective that might resonate in a different way. And so we're definitely always balancing, like, how do we stay relevant, both with evergreen content, but also with breaking news. If we have a measles case in our area, how do we handle that in a way that's responsible and perhaps a little bit differently than the media sources around here would maybe try to escalate fear? And maybe we need to be responsible with our fear and encourage people to pursue vaccination, but not raise the red flag and cause a whole bunch of alarm either. So it's doing that. That's been kind of interesting is navigating that balance too.
Yeah, I'm curious, like around the vaccination issue, where I've made this joke many times before, 2 + 2 is 4, the world is round, and you should vaccinate your children. These are just facts. When you put this information out there, and you're doing such a good job of getting lots of good information, do you see that you're getting less questions that frankly are way out there that, no, this is not a good idea not to vaccinate your child? Or do you still see that, where some sort of strange piece of information, or just to use the vaccination issue, where somebody still comes in with that kind of stuff?
Yeah, we take a conversational tone in our social media content. So we still get a lot of questions, a lot of feedback, and for certain topics, vaccine as an example, we'll get quite a bit of pushback from certain groups, and I think our goal is always let's just point back to the science, let's point back to the facts. We're not going to get in the mud with you, but we're going to point to validated, verified information, whether that's coming from the CDC, the AAP, really using our organizations that provide guidelines and quality evidence. We're going to point back to them and be reasonable, but also we're not going to let a lot of misinformation just live on our social media posts without responding to some degree. So I would say it's probably pretty similar in terms of what we get, but we've definitely gotten a little bit better about how we respond to it in a way to just make sure that the good information is out there and then not stress too much about somebody is negative.
Well, Dr. Smith, thanks so much as we kind of wrap all this together for giving us an update on how things are going for you and just your approach. I'm not even trying to be dramatic here. I was getting a little bit of a chills coming up and down my spine when you said like how much progress you've had with having other physicians contribute to blog posts and to online information. I genuinely feel like that is an important trend on the marketing and business side. We've got to pay attention to that and support that in every way we can to really, at the end of the day, have content make people better and healthier. So thank you for everything you're doing. And genuinely, we appreciate your time on the program today.
Yeah, thank you so much for having me. It was fun.
Paradigm Shift of Healthcare is brought to you by P3 Inbound. You can find our full archive of episodes with complete transcripts at paradigmshift.health and recommend a guest or topic on Twitter at P3 Inbound. Thanks so much.
Thanks again for tuning in to the Paradigm Shift of Healthcare. This program is brought to you by P3 Inbound, marketing for ortho, spine, and neural practices. Subscribe on iTunes, Google Play, or anywhere you listen to podcasts.